Hi class, welcome back. It's Dr. Linder. In this next few videos, we're going to be looking at the venous system. We'll focus on some of the main concepts to kind of give you a stronger foundation in your studies to help you with your readings and getting, the flow of everything back into the heart. So when we talked about the arterial system, remember you started at the heart, we worked our way up to the head. From the heart, we found a way to the upper extremity. From the heart, we found a way to the trunk and the abdominal area. And from the heart, we found a way to the lower extremity. Now, when we talk about the venous system, a lot of the names may be a little bit similar, where we have arteries, we have veins. If there's a radial artery, there's a radial vein. If there's an axillary artery, there's an axillary vein. If there's a brachial artery, there's a brachial vein, right? You have vertebral arteries, vertebral veins. So for the most part, they are parallel, they are analogous to one another, but there are some unique variations. And I'll make sure I try and point out what some of those unique variations are. But now our thinking, even though the names may be similar, the thinking from a functional perspective has to be distally moving to the core. So from the head, we start at the top and we have to drain blood back into the heart. It's got to find its way into the brachiocephalix, into the superior vena cava. From the arms, from the fingers, we work our way from distal to proximal again into the brachiocephalix, into the superior vena cava. From the trunk, from the abdominal region, we have to find our way into the inferior vena cava. From the lower extremity into the inferior vena cava. So when you look at this overview, we'll break it up and we'll have to focus on, how things go from up here and find a way into the right atrium. We'll focus on here and how do things work their way up and in to the right atrium. We'll focus on here and how do things find its way back into the right atrium. And then we'll look at the lower extremity. Okay, so wow, right? Write this all down now, right? Get it down. Here's an overview showing right here is the right atrium, right there. And so basically, how is blood going to find its way into the right atrium? That's really the key. So one of the ways is going to be through the superior vena cava. That's a way. So how do things find its way into that superior vena cava? There's a lot, right? So up here, we're looking at the head on the right side. Here, we're looking at the head from the left side. Here is the left extremity. Here is the right extremity. Okay. And then here is going to be more of like, when you hear azygous and hemiazygous, that's going to be like the thoracic region there. Okay. So we'll focus on some of those concepts. So let's start up here. What are some of the key structures? And we'll look at the head and neck. But right here, we're looking at the brain from inferior. And some of the key structures are going to be the transverse sinus, the confluence of sinuses, the occipital sinus. That's going to be kind of where blood is going to find its way superior sagittal sinus. Those are some of the biggies. And blood is going, and if you look at it from down here, here's the straight sinus, right? It kind of looks like it's going through the skull there. Here's our occipital sinus. Here's a sigmoid sinus. Here is the superior sagittal sinus right there. Those are the biggies. So it's going to find its way eventually, right? It's going to be draining down. It's going to find its way into the transverse sinus. And now if we follow the drainage, just look at the plumbing. Now it's going to be moving down this way into the internal jugular vein. There is a vertebral vein, right? You could see coming through this way, through the transverse foramen. And then there's an external jugular vein. Again, it's more superficial, right? But everything in the head has to find its way down into either the vertebral vein, the internal jugular vein, or the external jugular. And they were all, if we follow them, the internal jugular is going to lead right here, right? Here's the entrance to it, right there. So that's the right brachiocephalic vein. The right brachiocephalic vein is going to bring blood down this way, and that is into the superior vena cava, right? So if here's the heart, here are the chambers, here's the right atrium, you have the superior vena cava coming in this way, you got the inferior vena cava coming in this way, and then you got the coronary sinus right there, which is going to be draining the heart, the deoxygenated blood from the heart into the right atrium. Okay, so superior vena cava is going to be stuff from the head and from the arms pooling in. It's got to find its way in first to the brachiocephalic, then into the superior vena cava. Okay, so here's a larger view again from the inferior perspective. Let's look at which ones I want you to know from here. Here is the straight sinus. Here's the occipital sinus, confluence, transverse. Those are the biggies, and superior sagittal. Okay. Again, from this perspective, here's the superior sagittal sinus. We see it here. Here is the transverse sinus, right here. Here's the sigmoid, almost like the sigmoid colon, how it makes that arc and turn, right there. Here's the occipital sinus, right? If you look at the occipital sinus, it comes down right into the vertebral vein. Okay. If you look at all of this, here's the straight sinus right there. So these are going to drain right into the internal jugular. If we follow the internal jugular vein right into the right brachiocephalic, the right brachiocephalic would lead into the superior vena cava, which leads the deoxygenated blood into the right atrium. Okay. Now, what else leads into that right brachiocephalic? Here is the right subclavian, and here is the right axillary. So it's right axillary first, then the right subclavian, into the right brachiocephalic, into the superior vena cava, into the right atrium. If we start down here and work our way up, now we're looking into the left side. So we're going to have palmar venous arches, kind of like we had the superior and deep palmar arch on the arterial side. Now we have palmar venous arches. They're going to pool blood up. On the ulnar side, we have an ulnar vein. On the radial side, we have a radial vein. Then they pool up, 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 coming upward in this direction. Here's the brachial vein. So far, it's kind of like the arterial side, right? So let's look. We have an axillary vein, subclavian. So if we started here, thinking like an artery from here moving down, we don't have a, well, let's start it here. Left subclavian, right here, left subclavian goes under the clavicle, becomes the axillary. If we follow that axillary down and we come down this way, there is a brachial. But on both sides of the brachial, we see these two large veins that are very important. The one that's more lateral is called the cephalic. And we didn't have a cephalic artery, so it's the first time you're hearing that. And on the medial side of the brachial is one called the basilic. We see it down in the medial forearm, and we also see it in the medial arm. So here's the basilic, and here's the basilic. So those are the two new ones. So when you find the brachial vein, you'll see that it's coming off. It looks like the axillary comes down, and then here's the brachial. And now medial to that, we see the basilic. We'll put an M for medial. Basilic down here, again, is medial. Whereas the cephalic, that's lateral. Here's the cephalic. And we follow it, it goes down the lateral forearm as well, right there. So that's lateral. Okay, so blood is moving upward in this direction. So you have radials, you have ulnars, you have the palmar venous arches, right? So it's the part of the digits and the palmar venous arches, those are going to lead into those cephalics and basilics and work their way up. Okay, it's going to work their way up where you have the cephalic laterally, the basilic medially, and it's going to drain. You see that? It's going to drain right here into that subclavian, and then the subclavian leads into the brachiocephalic right here. That's the brachiocephalic trunk, but this is the left brachiocephalic trunk. There is a right brachiocephalic as well, and there's a left. So that left brachiocephalic vein leads into the superior vena cava. Now remember, on the arterial side, there was no left brachiocephalic artery, but on the venous side, there is a brachiocephalic vein. Keep that in mind. So now you're going to hear azygous, hemiazygous, and accessory azygous. Anytime you hear the word azygous, or we're thinking around the ribs in there and near the vertebral column. So the azygous vein ascends from the lumbar region along the right side of the vertebral column, and it joins the superior vena cava at around the level of T4, and it's going to empty the thoracic viscera. The hemiazygous is formed by the veins in the lumbar region. It ascends along the left side of the vertebral column, and around mid-thorax, it crosses anteriorly to the right to join the azygous. And then you have the accessory hemiazygous. There's an accessory. There's a hemiazygous and accessory hemiazygous that begins at the fourth intercostal, descends along the left side of the vertebral column. So let's take a look at that. The azygous and the hemiazygous veins, these are the chief collecting veins of the thoracic region. So the azygous, which is here, and the hemiazygous here, those are the chief ones, okay? So right there is the azygous, and then here is the hemiazygous, and then right here, this portion is the accessory. Okay, so the accessory is superior to the hemiazygous. Okay. So now let's look at, we did the veins of the upper portion. Now, how does the oxygen get from the lower part into the right atrium? It's got to find a way into the inferior vena cava. So we're going to have blood vessels from the trunk region, right, from the abdominal region. You got hepatic veins, gonadal veins, lumbar veins, phrenic veins, adrenal veins, renal veins. Those are pretty straightforward because when you see the organ and it's blue, right? If it's going from the diaphragm, they're phrenic veins. If it's going from the adrenal glands, they're adrenal veins. If it's going from the kidney, they're renal veins. If it's going from the testes or ovaries, gonadal veins. If it's going from the liver, hepatic. Okay. We had a right and left, left and right common iliac artery. There's also right and left common iliac veins. And the same thing, like on the arterial side, there were internal and external iliac arteries. There's internal and external iliac veins. Okay, there's a lot of parallels to that. So the inferior vena cava is formed by both the right and left common iliac veins anterior to L5, and the inferior vena cava, it will dump blood into the right atrium. Okay, there is a unique port called the hepatic portal vein. This is going to drain blood from the GI tract, the spleen, the pancreas, and gallbladder. Okay, so let's take a look at those. In the hepatic portal, you're going to hear superior mesenteric vein, splenic vein, right and left gastric veins, cystic veins. We're going to start seeing this. So here's the key. Let me put a star next to it. There's the hepatic portal vein. It's right here. And you see that there's a lot of contributories to that, right? We see like left gastric comes into that. We see the right gastric comes into that. Here's the spleen. So we see the splenic vein, the splenic tributaries to that. Here is the inferior mesenteric. So we see the inferior mesentery, the inferior mesenteric vein leading into that. We see a superior mesenteric leading into that. So you're getting all this deoxygenated blood from the small intestine, the colon, from the spleen, from the stomach, even from the gallbladder, right here, the cystic, and it's going to bring the deoxygenated blood, it's going to go into the port, the hepatic portal vein. Now that now you see it didn't bring all of the blood into the inferior vena cava, right? It didn't bring it into the IVC. It says, hey, how about we clean all this stuff out first. It's coming from the digestive tract. So it brings it into the liver to filter it. And then after it's cleansed in all of those liver sinoids, it's going to then divert it into the hepatic vein. So don't confuse hepatic portal vein with hepatic vein. So the hepatic veins then drive into the inferior vena cava. Okay, so here's the hepatic portal. We can see a bunch of tributaries, a bunch of veins, left gastric, right gastric, splenic, inferior mesenteric, superior mesenteric, leading into the hepatic portal. Hepatic portal goes into the liver does its cleansing. After it's cleaned, the cleansed blood goes into the hepatic vein, into the inferior vena cava, and from the inferior vena cava, it's going to lead into the right atrium. When we come back, we'll talk about the lower limb.